Hey guys, this is chapter 5 in Woody and Marriage and Family Ethics. This chapter deals with competency and integrity. If you look at the sub-principle in the MFT Code of Ethics, sub-principle 3.1 requires MFT therapists, as every other ethical code requires counselors in their discipline, to pursue knowledge of new developments to ensure competency in their work in order to provide aspirational clinical services and practices to their clients in order to maintain integrity in their practice model. So the 6 factors a therapist can rely on for clinical decision making in 87 and 88 would be to follow the ethics code and to follow the ethical decision-making model that you guys already have. If you look at some of the ethical decision-making models that take you down through a decisional tree, you'll see that the interest is in emphasizing all collaborators, all stakeholders. That will not change. Try to determine what is in the best interest and welfare for everyone. If you look at sub-principle 1.9, marriage and family therapists continue therapeutic relations as long as it's reasonably clear the clients are benefiting. That has to be one issue. They have to be able to benefit. If you define mental health and welfare as freedom from diagnosable mental disorders and serious psychological problems, you have to then determine what diagnosis is better suited for a reasonable term of service for counselors versus what is better suited for an ongoing issue such as those with a psychiatrist. In pursuing knowledge of new developments, one way is to look at the current literature, to be abreast of the current research, to apply the principles found in the new professional journals, keeping up with those, looking at those types of things, keeping up with current legal cases, current political changes and social changes, attending the conferences, maintaining close relationships with your professional organization. Georgia AMFT is available for any member. They have both a metro area and a Georgia AMFT South division. So if you're looking for sources of information for clinical decision making, you want to have a theory-driven approach that's associated with how families begin to have problems. What is tradition? How have things been done in the past, particularly if that tradition holds up over time? What is the skill or the availability of services that the clinician can offer? What is the cost? What is verifiable and systematic based on your clinical observation? Having objective information versus only solely subjective clinical assessment. And a final factor is to determine what kind of intervention that you would use based on a prescriptive continuum approach of family services. If you're looking at trying to outline and determine how to evaluate research literature based on what it is that you would like to base your practice on, it should always be peer-reviewed. It should always be accepted in a peer journal. It should follow good research models, whether it's quantitative or qualitative. Looking at some of the things that Woody has to say about evaluating research literature. There are standards, recommendations that apply more than 95% of the time. Guidelines are things that apply approximately 75% of the time. and options only apply 50% of the time. If you're going to base your treatment of families in distress on current literature, go with at least standards and guidelines. And if you are looking at options, understand that those types of things may not follow with what your family's best interest, where your family's best interests may lie. And let them know if you think that it's experimental. There's really no reason to go through experimental issues when there is this good, solid research, evidence-based, research-driven interventions to use. Looking at criteria of Shamliss and Holland to evaluate criteria for research, you look at the treatment in question. Is it superior to no treatment or to placebo? Is it at least equivalent? Has it been conducted with a treatment manual, a delineated population with valid and reliable outcome measures with appropriate data analysis? Is it shown to be superior in efficacy with a control group, particularly a waitlist control group? And does the treatment show to be superior to nonspecific or placebo treatment? I know some of this probably seems a little dull and dry. Point taken that ethics sometimes can be. It's not dull and dry if you're on the other side defending interventions that you chose. So when you're going towards your case analyses and understanding that for the purposes of this course, your third case analysis stands in place of your final, make sure that you have taken this particular chapter into consideration. If you look at 5 challenges that therapists face moving toward an evidence-based practice, and I know this particular, Woody cites a New York Times article by Carey. Is the study of interest to the clinical situation I'm facing, is it valid? Who are the subjects? How were they recruited? How accurate was the data? Were the measures valid and reliable? Were the statistical methods appropriate and properly executed? What did the study find? What were the implications of the study? Let me see. When you're looking to develop a evidence-based, is the method you're looking at worth learning? Is it something you have to practice through observation, training, reading? Do you have to gain some type of certification to do this particular thing that you may or may not have? Will you benefit from efforts to reinforce the practice over time? Or are you going to seek supervision and feedback on the interventions that you're using and the practice model that you're putting into place? So for that particular chapter, that kind of sums up. There are some things in Sprinkle on pages 123 to 154, 191 to 213, and 163 to 183 that you can look at to help yourself, particularly in the issues of marital problems and relationship problems with substance abuse and with adolescents. Look at those things as you're looking at your case studies and incorporate some of the things from Sprinkle in your research as you cite things through your case study. So next we are going to look at Chapter 6 in the following module.